We're happy this morning to have Dr. Bob Mastey here from the Center for Sports Medicine. Often when they are on the show, we'll focus on some sports injuries that you or your kids may have. But this morning, talking about your hands, a disease called Dupuytren's, which has hit my family. So I'm glad to get a bit of more of an education from you. Welcome to the show.
Well, thank you. And thank you for having me here.
It was a term that I really was not that familiar with until, I don't know, 10 or 15 years ago. My mother contracted it. Now I have a brother who has it. But the thing I'm excited to hear you talk about is how much your approach to treating the disease has changed.
Yes, it has. Over the past 7 to 10 years, we have a new treatment. And we still have the old treatments available. They include surgery of various forms. Some are more invasive than others. But I think you were discussing earlier today that with some of the surgeries that was performed on a family member, they just didn't get the results that they were seeking.
Right.
And so now we have a new treatment, and it's an in-office procedure. It involves an injection, and this injection is a enzyme that can break down the cord.
So let's talk a little bit, and you brought some visuals. I'll use my hand too to kind of show, but Dupuytren's, it affects these cords in your hand, right? Or is it veins that it's affecting?
No, it's not veins, and some people may think it's a tendon because they are so pronounced and they're linear and they follow the course of the fingers. So it's not a tendon, and what it basically is, it's a collection of normal cells that are normally seen in the body, but they're abnormally seen in the hand.
Okay.
And they go through a process in which they lay down collagen, and that produces the cord. And then just before they die, they have a muscle component to their...
Before the cells die.
Before the cells die. Before the cells die. So these cells lay down collagen, and then they contract.
Okay.
And then they just wither away. So what you're left with is a cord, and it's along the lines, it leads into each finger.
So what happens is, and I can tell you this because my mother has it, so and it affects both hands, one more than another.
Right.
And so with time, her hands have just kind of almost closed like that.
That is true. And it will affect the small and ring finger more than the index, middle, and thumb.
Okay. It's not painful though, is it?
It can cause some irritation in the beginning.
Okay.
Yes, it can. And that's the early stages. It's been around for a long time, and it has a very interesting history.
It comes from people of Northern European descent.
Northern European history. And you see it in the Scots, the Irish, the Germans. You don't see it in people from Greece or from India. It can also occur, a similar process may be seen in people who have trauma, but Dupuytren's contracture is a genetic problem. It's passed down, but it may not be passed down every generation.
Okay.
And therefore it's called incomplete penetrance.
Okay.
So you may see it in a grandfather, but not your father.
Does it tend to run more in men than women?
Yes, it does.
Okay.
And there may be some risk factors with alcohol use and some medicines that you use for seizures.
So let's talk about this, because the truth is, as it begins to impact you, like in my brother's case, he's 60, so it can he's a pilot, so it affects his job. So with these shots, this is life-altering for people.
Yes, it is. So before we had a couple treatments. We had, it first started off as just taking a little knife and making an incision in the palm blindly. And the problem with that is that there may be, unless you do a lot of those, there may be damage to the surrounding nerves and tendons, because the tendons live just deep to that cord.
Okay.
So that's one problem. Then we started doing operations in which you open up the skin completely, you eradicate the diseased cord, then you close them up. The problem with that operation is that those patients had difficulties extending their fingers, and then they had
So physical therapy after was hard for them to do?
Well, this is the ironic part about the surgery, is that their hands were contracted. They were able to flex more, but they couldn't extend. When you did the operation, now they had problems flexing their fingers as well as extending them, and they would have to work hard in physical therapy. You had wounds that often would be subject to separating. It was an arduous task to continue with the physical therapy. It was the burden of care on that one was...
I can speak to that personally.
Yes.
I watched my mom do it. So
Exactly.
if you have the disease, and maybe you've heard some of these horror stories in a way, this is something different. This is just not very invasive at all. You're dissolving that stuff. Right?
So what the researchers found is Clostridium, which is a very toxic bacteria, had an enzyme which was able to digest collagen. Well, they put it together and they said, hey, maybe we can use this to our advantage. So they pulled a jiu-jitsu move and they used something that was, causing damage to us. Now you isolate this, and now you specifically put it to the collagen cord, and you could eradicate that.
Okay, so Center for Sports Medicine, and we're going to show you as we end our conversation here in a minute, their main number on Macaulay. Y'all have so many offices around town. Pretty much if you're watching us in any part of the viewing area, you'll find a location. Can they go to any of the offices pretty much to have this procedure done? And how do you evaluate them when they come to you?
Offices, we have several offices, but I am at the Gun Barrel office.
Okay.
It's off of Gun Barrel, it's Ziegler Road. And well, they have to just call the office and we'll make an appointment. Evaluations are physical exam, family history, and we'll see what else is going on there.
If you are somebody who perhaps has this diagnosis newly made, earlier intervention, I guess, is even easier?
Yes.
Okay.
Definitely.
But if you've had it for a long time and this is something new for you, still give it a try.
With this drug, it's amazing on what we're able to achieve.
I will, and I keep telling you my own personal experience, but I've watched it impact two people who I love very much, and so it doesn't have to happen to you with this new injection. So thank you so much.
You're welcome.
Dr. Bob Mastey with the Center for Sports Medicine. Again, there's the number on Macaulay. Everything kind of factors through that number, 624-2696. But for your planning purposes, you'll find Dr. Mastey at the Gun Barrel location. Check out their website, sportsmed.com. And again, the injection is called?
Xiaflex.
Xiaflex, if you want to look it up. Thank you so much.
You're welcome.
We're back
Thank you.
after this.